Good afternoon. I want to welcome you to our meeting today, our presentation. My name is Dr. Jill Rush, and I am the MPH Program Director. We have a Master's in Public Health program that's a joint program between LSUS and LSU Health Science Center. And so we periodically throughout the year provide educational opportunities for faculty and staff. I want to thank the School of Allied Health, the Interim Dean, Dr. Dennis Wissing, and Madeline Fector for helping set this presentation up today. We have the privilege of having Jeanie Donovan from is the policy director at the Louisiana Budget Project, come and speak to you today about poverty, income, and health insurance coverage in Louisiana. She'll also cover issues about the state tax and budget issues that impact the hospitals, higher education, and health care for professionals and patients. We had the opportunity to have her speak to the MPH students last night, and it was a very engaging presentation, and the students seemed to really gain a lot of knowledge about health care in Louisiana and about the budget process. So I think that you will find today a very interesting presentation, and we want to welcome her for coming up here today and presenting. She will be around afterwards if you have any questions, as well as myself and the MPH program. So thank you for coming, and I hope you enjoy the presentation. Jeanie?
Thank you, Dr. Rush, for that warm welcome and introduction, and thank you to Dr. Wissing and Madeline for inviting me to be here today and hosting me last night and through this morning. Let me make sure I have my clicker here. So, as Dr. Rush said, I work at the Louisiana Budget Project, which is a nonprofit, nonpartisan research and advocacy organization based in Baton Rouge. And we focus on state budget and policy issues affecting low and middle income people in the state. I am the health policy analyst in the office, and so we are a multi-issue organization, but I primarily focus on health policy issues affecting low and moderate income Louisianians. Today I'm going to talk to you a little bit about poverty, the status of poverty, healthcare, and the state budget, and some of the interactions between those three things. And I want to share that I think each of these three topics could probably be an hour-long presentation, but I really wanted to make my trip up to Shreveport worth it and make sure that I delivered as much information to you as possible. So if there's anything that you want to follow up on with me afterwards, my email address is here and will also be at the end of the presentation, and I'd be happy to have a follow-up conversation with you. So I want to start by looking at some of the most recent poverty or census data that came out last month. Louisiana is a very poor state, as many of you know. We have the second highest poverty rate in the nation. We have the first, as of this year, we have the highest child poverty rate in the country. Almost 30% of our children in the state live in poverty. We have the fourth lowest median household income of all states. And one really interesting thing to note is we have the fourth highest rate of income inequality. And so this is the comparison of how much the wealthy earn compared to how much the poor earn. And the interesting thing about Louisiana being fourth is that the first, second, and third states are Connecticut, New York, and Washington, D.C. So Louisiana is sort of the outlier here because we think of those states, the northeastern states, as the really wealthy states where there are many billionaires and millionaires that really drive that distribution towards inequality. But in Louisiana, we have just an enormous number of people living in poverty that create this inequality. And I'm going to talk a little bit more later on about how our tax structure actually drives this income inequality rate. We have deep, deep racial disparities in Louisiana when it comes to poverty. So about 20% of people overall live in poverty in Louisiana, but when broken down by race, we see that 33% of Black Louisianians live in poverty. So 1 in 3 African Americans in our state are in poverty compared to just 12.5% of whites. When we look at racial breakdowns of children living in poverty, it's even more alarming. Almost 50%, 47.1% of African American children in the state of Louisiana live below the poverty line. That's compared to just 15% of white children in the state. And so this is a really important point to think about as we think about how we're serving underserved populations and who we're targeting our resources toward. We also have alarming gender disparities when it comes to poverty in Louisiana. So women are about 20 to 25% more likely to live in poverty than men in the state. So women, the female poverty rate's around 22% compared to 17.7% for men. One really disturbing statistic for me is that the percentage of women who are employed but living in poverty is nearly double the percentage of men who are employed but living in poverty. And we're going to talk a little bit more later about what drives that number and the difference between male and female dominated occupations. Women earn about $200 less per week and about $17,000 less per year than the median man in the state. This is a breakdown of poverty by region, by MSA, or Metropolitan Statistical Area. And the green line represents the statewide poverty rate, which is just under 20%, so 1 in 5 people in the state. I have the 3 red arrows on the metro areas that are far above the statewide rate, and you can see that Opelousas, Shreveport, Bossier, and Monroe are outliers when it comes to poverty in Louisiana. And we can see that poverty is ticking down a little bit in Shreveport, Bossier, and Opelousas, but overall, we have real problems with poverty in this part of the state in particular. And so this is something that's important for healthcare providers and patients to keep in mind. Wages in Louisiana have been stagnant overall. In fact, when we adjust for inflation, over the last 10 years, between 2007 and 2017, wages have actually, median wage in the state has actually gone down by about $2,000. And so this is really problematic as we see the cost of living increase, rents going up, groceries cost more, and the incomes of people in Louisiana are remaining the same or even going down when adjusted for inflation. This is the reason that we see our poverty rates ticking up in the state, because wages are not budging. When we look at the rate nationwide, we see a slight uptick in the national median wage or annual earnings, but this is a problem that's not specific to Louisiana. It is a nationwide problem where the bulk of, as we see the economy growing, as we see unemployment going down, the bulk of the benefits are accruing in the top 10% of income earners, and the median wage is not budging at all. Another big challenge that drives poverty in Louisiana is that about 1/3 of our households with children are single female householders. So about 150,000 households in the state with children have a single female householder. When we look at work status, so these women that are single females with children are more likely to be in the workforce than married women with children. So about 80% of single female householders are working, or are in the workforce, meaning they're either looking for work or they have a job. The problem is that they're not earning very much. So when we look at the median income of households by married couple with children, single female with children, and a single male with children, we see that the single female with children is making about $21,000 a year, compared to $92,000 for the 2-parent household, and it's even half of what the single male householder is making. And so to me, when we think about this statistic, this number of households, 1/3 of all of the households with children in the state, and we think about the median income, and when we say median, it's important to remember that that's the very middle. Half of these households are earning below that, and half are earning above. Why is that? So we know that, I did a breakdown of the female-dominated occupations compared to male-dominated occupations, and this is Louisiana specific. And if you look at the median hourly wage of the female-dominated occupations compared to the median hourly wage of male-dominated occupations, you can kind of get a sense of why female-led households are earning so much less than single male households and 2-parent households. Another component to this is that we know that women are typically the primary caretakers of children. And oftentimes, I don't have a slide on this, but I like to mention it just because it's so important, that childcare is very expensive. And so women often have to work half-time or don't take the promotion at work, or they have to leave the workforce because they can't find affordable childcare for their kids. And that's a problem that disproportionately affects women in the state compared to men, even male single householders. And so the low wage work combined with the challenge of finding affordable childcare leaves many women and single mother families living in poverty. So that was really depressing, I know, but I want to talk about one big bright spot in our state, and this came through in the recent census data that I mentioned that came out last month. So one very exciting thing for me when I looked at the census data for 2017 is that this purple line represents the U.S. uninsured rate, so the percentage of people in the country that don't have health insurance, and the blue line represents Louisiana's uninsured rate. And you can see that Louisiana, sorry, I have that flipped. Louisiana's on the top. Louisiana has been significantly above the national uninsured rate for years, except for this year. So we saw Louisiana's uninsured rate dip down to 8.4% in 2017 compared to 8.7% nationwide. And if you follow national rankings like I do, you know that Louisiana definitely doesn't usually perform above the national median and is usually at the very bottom. So for a statistic like this to appear, it really is exciting for me because it's not only about statistics, it's also about people. And I'm going to share with you some of why this happened and what it means for our state in a moment. I do like to note here, though, that the national uninsured rate ticked up. The reason Louisiana went below it is because the national uninsured rate has actually gone up a little bit between 2016 and 2017, and that's because of things that are happening at the federal level with repealing the individual mandate, undermining some of the components of the Affordable Care Act that's caused people to lose their health insurance over the last year or two. So the reason for this substantial drop in the uninsured rate in Louisiana, so people without health insurance, is that on January 12, 2016, this is a picture of Governor John Bell Edwards, who I heard was on this very stage a couple of weeks ago, signing an executive order on one of his very first days in office to expand Medicaid to low-income working people in Louisiana. So before Medicaid expansion, if you were a low-income working-age adult, it was very unlikely that you were going to be able to qualify for Medicaid, and it was very unlikely that you were going to be able to afford private health insurance, and therefore you remained uninsured. That's when we had around a 16 to 20% uninsured rate in the state, which has been cut in half thanks to Medicaid expansion. We became the 31st state to expand Medicaid. You can see many of our neighbors have chosen not to do the same. This is a graphic that the Louisiana Department of Health updates almost on a daily basis, and if you haven't seen this, I highly recommend you check it out. If you Google Healthy Louisiana Dashboard, it will come up. And this shows the number of Medicaid expansion enrollees by parish. And I was able to screenshot this with the Caddo Parish data popped up. And over 26,000 people in this parish alone have gotten health insurance coverage in the last 2 years since Medicaid expansion has been in effect. I did the math, it's around 14% of the adult population in the parish. So that's a lot of people getting coverage, and they're not just getting coverage. If you can read this fine print, you can see that 72% of those people had a doctor, a primary care visit. And these are people who probably weren't able to see a doctor on a regular basis before getting this coverage. You can see the number of breast and colon cancer screenings that happened. So these are folks who are getting cancers detected and in some cases cured through Medicaid expansion. And you can see that it is in some of the more outlying areas. We tend to think about safety net programs like Medicaid affecting the urban areas of the state, but you can see that even in some of our more rural parishes, that many people are getting coverage as a result of Medicaid expansion. This is the other piece of the dashboard that I really love, and I think it speaks volumes about the importance of Medicaid and how it's saving lives. They keep a running ticker of the number of adults diagnosed with colon cancer, the women diagnosed with breast cancer, the tens of thousands of people who are getting mental health services, substance abuse treatment as a result of Medicaid expansion. And so as of last week when I made this presentation, 485,000 people in the state had gotten health insurance coverage as a result of Medicaid expansion, and this has given them access to life-saving services. Now I wanted you to think back to the single female householders that I mentioned earlier. This is a breakdown of Medicaid expansion enrollment by gender. And you can see that as of this month, of the roughly 500,000 people who had enrolled in Medicaid expansion, 300,000 of them were women. So about 100,000 more than men enrolled in Medicaid expansion over the last 2 years. And so this is helping those women, those single moms who are earning $20,000, $22,000 a year to get the healthcare coverage they need and to make sure that they're healthy enough to continue working and continue caring for their children. It's also important for men. So not only does Medicaid expansion benefit patients and ensure that they have life-saving care, it's also creating jobs and stimulating our economy and ensuring that doctors and physicians are able to see patients with coverage. So a study from LSU in Baton Rouge showed that Medicaid expansion created 19,000 jobs in the state in 2017. It had a $3.5 billion economic impact in the state. It brings in billions of dollars of federal Medicaid funding into our state that otherwise wouldn't be coming to our hospitals, our doctors, our clinics. And so this is not only a health insurance program, it is also an economic stimulus through an infusion of federal funds. It also cut our uninsured rate in half. So the question is, I just shared with you some alarming poverty statistics, some more uplifting healthcare statistics, but the question remains sort of why is Louisiana performing so poorly on so many measures, including the census? So it has a lot to do with the way that our state provides or doesn't provide services, basic services like education, healthcare, higher education, and other supports that families need when they're struggling. And that's because in part because our taxes are very low. Louisiana as a state collects a very low amount of revenue from taxpayers in the state. We have the 45th overall lowest state and local sales taxes at 7.6% of all personal income in the state. That's about half of the top states in the nation in terms of state and local tax revenue. We have the 39th lowest income taxes. So our income taxes are particularly low in Louisiana, and only 42 states have income taxes, so we're at the very bottom here. The income tax is really the progressive part of our state tax structure, because with an income tax, the more you make, the more you pay, because it's a percentage of your income. On the other hand, we have extremely high sales taxes in the nation compared to the rest of the country. So we have the second high, as of July 1st of this year, we have the second highest sales tax rate in the country. We were number one. The state legislature cut taxes from 10%, sales taxes from 10% to 9.545% this spring. So we dipped it just below Tennessee by a hair, but our sales tax rate is still really high. And so this is the tax that you pay when you buy clothes or you buy school supplies. These are things that everyday low-income working people spend most of their money on taxable items. So it's a regressive tax because it bears most heavily on low-income people, whereas higher-income people put more of their money into savings or retirement or other sort of stock funds that aren't subject to sales tax. And so they're able to escape this hefty tax on most of their income. And this is really reflected in this graphic, which shows as a percentage of their income, how much do the different income brackets pay in taxes. So this represents the lowest 20% of income earners in the state, those making below $17,000 a year. This represents the top 1% in our state, earning $473,000 or more per year. So there's a big income gap here, and this is everyone in the middle. And the poor in our state, the poorest people, pay 12% of their income in state and local taxes, compared to just the top 1% that pays 6.2% of their income in state and local taxes. So as a percentage of their income, the poor in our state are paying double what the rich are paying. And these are the sorts of state-level policies that drive income inequality in our state. And they also undermine the ability of the state to provide services to low-income people, which we'll talk about now. So this graphic depicts total state revenue collections over the last 20 years. And I like to split this graphic in half from pre-Katrina and post-Katrina. So 2005 is right here, and the blue line represents actual state tax collections, the total amount of money the state has taken in from all taxpayers. You can see that before Katrina, the blue line was fairly steady. It didn't go, it was following a pretty steady trajectory until Katrina hits in 2005. And in 2005, post-2005, you see this bump in state tax collection, or state revenue. And this is a result of a few things. So our state got a lot of federal recovery money coming in after the storm hit. Oil prices were high, and the housing bubble was growing. When the state was taking in all this money, they decided that since they had so much, that they might as well go ahead and cut taxes. Because if we have excess, we want to give the taxpayers back some money. Governor Bobby Jindal, with support from most of the legislature, Republicans and Democrats alike, cut income taxes and expanded corporate tax breaks in 2008. And we all know what happened after at the end of 2008, beginning of 2009. Stock market crashes, the recession begins, the federal recovery money after Katrina dries up, and oil prices tank. And that's what you see depicted here. Starting in fiscal year 2010, we experienced a huge drop in revenue. The state is operating at a significant deficit that it really hasn't made up for over the last decade. We saw Governor Bobby Jindal patch together one-time money, and he really was able to plug some holes with some finite resources that have been expended. And so we did manage to kind of maintain status quo for a number of years, but right toward the end of his second term, things started to get really bad. And folks who work in higher ed or hospitals know that ever since the tail end of the Jindal administration, we've been really struggling to maintain services and funding for important programs in Louisiana. You see a slight uptick here in 2016. This was the imposition of a temporary 1-cent sales tax. So our sales tax in Louisiana went from 9% to 10% for 2 years. And so that helped us close that gap, that operating gap, but it didn't get us quite there, and it actually expired this summer. They renewed about half of it, but you can still see that we're still operating below where we were pre-Katrina. And this is what causes the perennial budget gaps that threaten healthcare and threaten higher ed and threaten the TOPS program year in and year out. And this is the issue that we need to fix if we're going to have a real long-term comprehensive solution to this budget crisis that we face. I'm going to talk a little bit now about why healthcare and higher ed are always seem to always be on the chopping block when the state's facing budget challenges. So this pie chart represents discretionary state funds. This is the money that the state legislature gets to play with every year. So the state takes in about $10 billion from taxpayers every year. A lot of that money, about 2/3 of it, is what we call dedicated or non-discretionary, meaning the legislature has no control over it because it's already been constitutionally or statutorily dedicated to certain things. One great example is K-12 education. So the legislature does not have the ability to change or to tweak. They can add money, but K-12 funding is dedicated every year, and it goes to that no matter what. There's about $3.5 billion that's not dedicated, that the state legislature can cut from if they have to, and the legislature is required to balance their budget every year. So if there's a shortfall, it has to come from this roughly $3.5 billion, and this 60% chunk here is healthcare, primarily healthcare and human services. This 30% chunk is higher education and TOPS. And so this is the reason that when there's a $1 billion budget shortfall, that we see news headlines and we hear lots of talk about closing hospitals, kicking people out of nursing homes, and taking away TOPS from students. It's not because that's what people necessarily want, legislators necessarily want to cut, but that's really the only places that they can cut. And this has had a real impact because they have been cutting. There have not been substantial efforts to raise revenue, so the option on the table has really been cuts. Louisiana, a national study came out last month that Louisiana has cut the most per student out of higher education of any state in the country. $5,000 per student per year has been, when adjusted for inflation, has been cut out of the Louisiana higher education system since 2008, since the recession. Children and family services, so foster care services, child welfare, and food assistance. The agency that administers those programs has been cut in half since 2008. This was an agency and services that were really targeted under the Jindal administration for cuts. And this affects the way that our children and our families are able to function. And now to healthcare. So I pulled a couple of headlines that kind of gave me PTSD when I pulled them from earlier this year. So this spring, the state was facing a $1 billion budget shortfall. And again, it had to come out of that $3.5 billion. And so raise your hand if you were aware or you saw headlines like this or you heard things about healthcare system, the public healthcare system and medical schools being jeopardized as a result of state budget cuts. Okay, yes, good. I'm sorry you had to go through that. It was something that the leaders of this institution and of the hospitals really fought hard, tooth and nail for in the state legislature in Baton Rouge, telling members that this is not the place to cut funds from. These are critical services, these are critical universities, critical medical school programs. And so, but the reason behind this is that the state is not collecting adequate revenue, and it threatens not only our hospitals and our healthcare and our medical schools, but the healthcare coverage itself that patients are receiving. This is a chart, this is a list that I actually cut out the middle part. This was the priority list from the State Department of Health. These were all of the cuts that were on the chopping, all of the healthcare programs that were on the chopping block in earlier this year. And this was the priority list for, as more money became available, what they would fund. And so we see services for children with disabilities, for individuals with developmental disabilities at the top of the priority list, and those are sort of lower cost programs that the state always wants to fund first when new money becomes available. Down here at number 14 on the priority list are Medicaid payments for the public-private partnership hospitals. And we know that we have one of those hospitals not far from here where many of the medical students and allied health professionals train that was on the chopping block for Medicaid payments. And this is just state funding. For every dollar the state spends on Medicaid in a hospital, the state receives about $4 to $5 in federal funding. So if this $200 million went away, almost $1 billion would have been ripped away from Louisiana's safety net hospitals. And there's I think 11 of them across the state, including the one here, or 2 here. So what are the solutions? You know, this list could be a lot longer, and I could probably spend an hour talking about each one of them, but these are just five of the potential solutions that I think could really move the needle in Louisiana, make sure that we have a more stable revenue stream, and that we're able to take care of the people of the state in terms of their healthcare needs, their higher education needs, and other vital services that the state provides. So we need to reform the state tax code and make sure that everyone's paying their fair share, and the state is collecting enough revenue to fund the things that are priorities for the low and middle income people of this state. We need to raise the minimum wage. We are one of the only states without a state minimum wage law. Louisiana abides by the federal minimum of $7.25, which hasn't been raised in almost a decade. And when we think about inflation and we think about those single moms who are working in those jobs that pay a median of $8 and $9 an hour, a minimum wage increase would have a substantial impact on the lives of them and their children, and it would have a substantial impact on the life outcomes of them and their children, especially their children. Data show that in all of the states that have expanded or have implemented a statewide minimum wage above the federal minimum wage. And I want to make one note on that you know, a lot of localities and other places in the nation have increased their minimum wage. And does anyone know why a place like Shreveport or New Orleans or Baton Rouge hasn't raised their minimum wage? It's because the state prohibits it. So the state passed a law about 10 years, maybe 15 years ago now, that said no local government could raise its local minimum wage. And so we know that there have been efforts in Monroe, there have been efforts in New Orleans and Baton Rouge. I'm not sure about if I haven't heard of an effort in Shreveport to raise the local minimum wage, but I know there's grassroots support for it here. But local leaders their hands have been tied in terms of being able to raise the local minimum wage in a city or parish. That's something that could be reversed at the state level as well. investing more in education and job training. We know that our state's K-12 funding formula has not been adjusted in 10 years for inflation. It's been held stable. That means that every year as inflation grows, our K-12 schools are actually receiving cuts. We need to maintain Medicaid expansion. It's something I talked to the public health students about at length last night, but there are many proposals to either freeze Medicaid expansion enrollment, to reduce eligibility, or to apply punitive measures of requiring people to make premium payments, requiring 20 hours of work per week, various other proposals to try to restrict the number of people that get access to Medicaid. And finally, this is the most obviously ambiguous solution that's up here, and it's one that we think about a lot of the budget project, is reducing racial disparities. So I started my presentation by talking about the serious racial disparities that we have in Louisiana, and they're even more particularly pronounced in places that have high minority populations like Shreveport, New Orleans, and Baton Rouge. And there's lots of efforts here. I'm not an expert on it, but I think the efforts to reform the criminal justice system, the efforts to improve reentry services, the efforts to reduce discrimination, these are all things that are going to raise people from the poverty and the challenges that they're facing in the state, and make sure that we're all doing better when we lift those people from the bottom. And I think that that's something that we continue to chew on. The legislature doesn't like to talk a lot about how to address racial disparities, but it is something that if we don't address head on, if we don't talk about, that it's going to continue to undermine the success and prosperity of our state. And I'll finish by saying, if you are interested in staying abreast of these issues, if you want to know what's going on in Baton Rouge, we also tend to cover local and federal issues as well. We send out a daily news roundup of issues affecting low and middle income people in Louisiana. If you go to our website at labudget.org, you can enter your name and email address to sign up for the Daily Dime, which will come into your inbox between 9 a.m. and 11 a.m. Every day, with the exception of holidays and weekends. And again, if you have any questions on any of the things that I touched on today, I encourage you to reach out to me. My email address is here. I have cards. I'd be happy to chat with you at length if you have more specific questions about anything I touched on. And with that, I'd love to open it up to questions, comments, or anything you'd like to share.